Another beautiful Tuesday, and the Akufi Princess is back on your TV, and this is Girl Vibes. Yes, my film Papa. Yeah, it's been a week now. There are good news, so I think I have to let you know. First of all, Girl Vibes. In the last year, we were nominated for Ghana Tertiary Awards. This year again, yes, there's been another nomination for Girl Vibes, of which the program is coming up this Friday. Intimate, that is the good news. Now, good news, the Mace Mabaya Yaba crown and proper. Not next week Tuesday in Kobeya. So that makes my year we need Goa Awards, you know, most empowering TV show of the year. Yakwaje Bain. Last year, no, or this year, so too much tertiary awards in the Zibafia. It's short code, no, on an Ogu screen, and making sure there about www.crossmarkup.com and select the category and fill in your details, select the number of vote and submit, and then you select the payment option to vote for Girl Vibes. In Tikoha, a category no now for Girl Vibes for best tertiary TV show of the year. Now, Yewini also no me producer has been nominated for an award. International details no go on Mr. Mo. Monfa code in the star 928 star 310 hash. Now vote for my producer Rashida Hamid, yes, producer of the year. Na Yewini ningi na no na yen fambra mo. And there's a mark on it. Enti Mr. Ma ye here vote ne hu here me pa. Enti mo vote na mo fama Girl Vibes. Na de biano, you know, morani to monko up. Na you know, we should feel proud today. Juma yes a bramono. I mean, this show is for the young women and tertiary phones also Kahubi. And to be nominated for tertiary awards, it means we've been stamped in there. And it makes more beya or beya for the Mr. Voting tentem na from my Girl Vibes. And then so uncommon and new beya tight. My catcher already in the start on Girl Vibes. This month is Pink October, which is the breast cancer awareness month. Ain't here every Tuesday beyond Girl Vibes piano yet in commotion yes a brother last week yes celebrating no brad day no my who the no brad day no yeah there sabi but yeah akukwe who be showcase no free can not share the no brad day but the significance no on you there be check for next screen nobody especially the breast then who there's no lumps in your breast. You are safe towards breast cancer. Now, you breast cancer crowd, yeah, baze. It's in the last week, you promised so then they ba you bodomusuko. Now, you who what breast cancer really is. And in the more beautiful nurses will fear her. May introduce to one more. Now, many your saying so. We are trending and we are streaming live on Facebook at eTVGhana. And Mr. Please go on Facebook at eTVGhana and make sure you like and then you share. Now, Obabia, what's the star? Oh, mamu. Obabia here and them come my year, and there were general nurses will fear her 1 year brought to Komono. We are also live on GoTV channel 177, and my name is Mercy B, the Akufi Princess. Now, before I didn't come watch to no better said no, yen try a hoka crananka obeya, yen fine beauty tip of the day, no so yen fan to adonaya ba, yes and Komono, yes, I said on WhatsApp is 02022222054. We'll be back on this. Yes, so let me say a big thank you to Adonko. Yes, Adonko Next Level Premium Energy Drink. And they want a debut. I was here and I say my yes and beauty tips on the yes bro. And we are talking about how to fade out all the scars. Mankas akra them tutorials me here pa into ye show na. Me come back on Facebook na machine here because I have a lot of scars. And I think I have to stay, fade them with the lemons and all the cold waters and all that. It's in here. Welcome back from the break, and this is Girl Vibes. Tonight we are talking about breast cancer. Now, I don't call Next Level Premium Energy Drink, no sister. They be a make sure day. Men try no be sugar. And the yet say na finance minister say. Juma binds them and dumb the crown, payroll the crash, can am the wasa. And to obey uncle be an anchor so employing no ho. Sister, Ben China ban back and show the payroll scassa. My catch your call, I don't call Next Level Premium Energy Drink for. I quite catch on the messy BC. One more way, Juma, whiskaka carne one sugar. And the energy drink Next Level Premium Energy Drink no by Adonko. And one at Sisiano Bianum. here was in area Jumana Shana Sabra. I don't call next level premium energy drink. Oh, can't. So I come. Black can with a gold label on it. Not one number near 0204898698 and that's 0592610998. From one bomo Juma na aye. Now and then so your studio had discussion yasha say ko Facebook at happy at eTVGhana more by yen. Not chadem komo chuchuni yasha. Me wa general nurses wofia me wa Farida Ibrahim. Farida, welcome. You're looking gorgeous though, in your Maya Fikakra and your peach outfit with that beautiful smell. Maybe I should cooler. And Becca was like a cra, Nayaka, she kakra, fancy kakra, brofus, the mechanic in Akaka. Now, me wa Aisha and Sophia, na Aisha sana, Nankasa Suya Monkey Simio, and the Aisha say, Mankasami Crummy Monkey Simia, and see there about Monkey Sim common so set, I am forget to be here. Monkey Sim Bessia Funos who won't hear him. And when it comes to that breast cancer education, or Baby Anson who hear girl vibes, and see they watching breast cancer home common. I say radio, about my education in English. General nurse, I mean, my hand won't feel like a crack. That you who ye general nurses now when you walk a hospital or not you come away a bit.
General nursing no say could be a general nurse or I want to miss my own midwife specialized in delivery and but general nurse in the BBA it's when me bow crab to my wow wow it's make a multi-talented and now multitask say they be into breast cancer and crab to my screen it's in day before I ever corner self-examining in an Farida also the same thing okay and the mama fashion chassis as in that me you are couple of funny people now Asha when we talk about breast cancer cry. I'm as in breast cancer. Well, so I got a breast cancer. Oh yeah, it's a disease that affects the breast cells. So it means when you say someone has breast cancer, it means that the cells in that person's breast are dividing more than they should be uncontrollably. So yes, and then it's when it's not found earlier, it tends to affect other organs. So that's why we advise that every month everybody should self-examine their breast, so we catch it early and then we prevent all that.
Treat it.
Yes.
Okay. Farid, is there anything you would like to adapt to that definition?
Yes. Breast cancer is a cancer of the breast, and in which occurs when the cells in the breast go out of control.
Okay.
So normally we are made up of genes, your genetic makeup.
Okay.
So these cells work based on your genetic makeup. So when these cells go out of order or abnormally, that is when we
the breast cancer.
Yes, in this breast, that's when we say we have breast cancer.
So what really causes it? What causes this breast cancer thing?
Cause of breast cancer is unknown.
Okay.
Research is still ongoing, but there are risk factors that predisposes a woman to breast cancer. So when these risk factors, when you have these risk factors, that means more than any person else, you are more at risk of having breast cancer.
Okay.
So some of these risk factors could be being a female. 99% of breast cancer cases are found in females. So being a female predisposes you to breast cancer.
Okay, so it means being also breast cancer.
Yes, men, but it's rare, but it's the
mostly for the women.
Yes, it's mostly 99% is a very high percentage. Yes.
Is that it?
Not really, but mostly we say cancer is also prone to people with dense breast tissue, and you know men have their breast tissue are not as heavy as ours. Yes, so it could also be one of the causes.
Okay, Aisha, let me come back to you. What are some of the things that we do or my breast cancer? Because honorary cano or share that we don't really have those courses, but in this case, no, is there anything really. I mean, no, Bamberry, yeah, because and then I'm a never presenter because I radio do, and I was telling him that maybe no my one pay girl. We were talking about be my one pay girl because they feel and I don't know you'll be and then I'm going to no don't worry. So oh girl, wait for you about what break now wada. And I was advising though they girl because even enough for the crying to chew who in as now, what's my cancer and I'm American.
Well, we have something we call risk factors.
Okay.
So when we say risk factors, it means that when you fall into any of these, you are predisposed or your chances of getting them are increased.
Okay.
So for instance, she says being a woman increases your chance. And then we say women older than 50 years are more likely to get breast cancer. People who are exposed to radiations, so X-rays, they are more at risk. Children, teenagers who have their menarche, when we say menarche, first menstruation, before the age of 12.
Okay.
So when you menstruate before 12, you're also at risk of getting
breast cancer.
Yes.
Wow, it is mental.
Yes. Women who have their first, or women who give birth after age 30, you are predisposed to getting breast cancer. People who's taking alcohol a lot, you are also at risk of getting breast cancer. Yes. And then when mothers get to menopause, there are sometimes, because of the menopausal symptoms, they are given some drugs. We call them hormonal therapy. And then those drugs also predisposes them to getting breast cancer. Obesity also predisposes you to getting cancer. And yes.
Okay. Now, Fari, coming back to you, what are some of the symptoms that if I start to feel them in my breast, I should be scared that, there is a trouble coming into my breast. I should fear for breast cancer.
Yes, there are many signs and symptoms, but first of all, you should know your breast very well.
Okay.
Everybody and have individual breasts. You should really know your body very well, so that any slight change, you might notice that there is a problem. But some of the signs and symptoms could be you feel a lump. There's a lump upon, lump in the breast. This lump is hard and it's firm. And also when it's more harder than the breast tissue, so our breast is soft, but these lumps are harder. And it's embedded in the tissues of the breast.
Talking about that, I was just, checking. So that's a picture of how a breast that is affected with cancer looks like, right?
Yes.
Right on the screen. Yes. That is how it looks like. Wow.
This is a discharge on the breast.
Wow. So how long do you think this type of cancer has been in the breast? Or you can't really tell by looking at the breast?
Well, you can't really tell about the time, the time frame. It depends. It's individual. But then it occurs as a result of cell division. The cells in the breast, as they grow out of order, they divide more rapidly than they should normally. And we can't feel the lump unless it has divided up to about 30 times. So it divides from 1 into 2 into 3. So the 30th time is when you feel the lump in your breast. And by that time, the lump could have been about 2 to 5 years in your body. So that's why we encourage regular screening. So we detect these things early before they grow cancerous.
Okay. So in developing the cancer itself and the lumps coming into the breast, Aisha, how long does it take to develop for the lumps to spread into the tissues that you spoke about to become the cancer itself?
So that's what she said, that before we would detect or you would palpate, you would feel that there's a lump in your breast. It would have taken about 2 to 5 years, depending on the individual and then where exactly the lump is located. So we can't say that, okay, this breast or this breast cancer took 3 years. We can't say for sure. But yes.
Okay, but actually, breast here or that screening disease here now, it's normal breast, on shada and sedam. It looks a bit abnormal. And then what sign a cry who toku be is that how the breast cancer type of breast looks like?
Yes.
And then it's according to stages. So it could be that initial stages it was just swollen, but as time goes on, it develops into an ulcer like what we are seeing, sometimes more than what we are seeing, and then it spreads to even other parts of the body.
Okay. Now, at what stage in a breast cancer person get to go under the knife, if I'm to call it that way? The stage where it's out of control, or there, you know, you have to be operated. Should I call it that way?
Surgery.
The surgery, yes.
Yes. So we can't, like normal, we can't say at this time or at this time. It depends on the stage. They take a lot of factors into consideration. You have to go through labs, scans to see where it has spread to and the tissues it has affected. Sometimes it just affects the surrounding tissues, but sometimes it spreads.
Okay.
So in those cases, you would recommend, the treatment recommended could be different.
Okay.
There could be 2 treatments, or sometimes just surgery is needed to take out the tumor. Or sometimes you add other treatments like taking drugs, chemotherapy.
So those are the stages?
No, those are not the stages. Those are the treatments, depending on the type of, the stage of the cancer. Yes, that.
So can you brief us on the stages so we get to know?
Okay, the stages, we have 5 stages.
Okay.
The stage 0, the stage 1, the stage 2, 3, and the stage 4. And then the stage 0 is when the tumor is just in the ducts of the breast or in the lobes. Yes, it's just inside. It hasn't spread to the surrounding tissues.
Okay.
And then we have the stage 1, which is the tumor is about 2 centimeters in the breast, and it hasn't affected any lymph nodes. When you talk about lymph nodes, there are structures in the lymphatic system which are also affected by breast cancer.
Okay. Asha, my member who when you were talking earlier, you mentioned radiation, of which I know some miss science back in the days. It has to do with the sun. Does it mean that and by exposing and then where we are breaking yet to move on or to my hand breast cancer?
Well, when we say risk factors, it doesn't mean that when you experience them, you are definitely going to. No, it just means that your chances are increased.
Okay.
Yes. So yes, radiation, any form of radiations, predisposes you, puts you at risk. So yes, all those are factors. So from microwave, X-rays, all those, even our telephone we use, all those radiations.
Hey, and to phone calls you crowd to my breast.
But
no, it's
they are not causes.
Factor.
They are just risk factors.
And a risk factor, in fact,
it's a probability that you might, like, it's when you have those factors in place, it means you are at a higher probability of developing the disease. But it doesn't necessarily mean that you would get the disease.
Okay.
Yes, but
so talking about the phone, is it that say the phone is saying no phone there?
It could be.
Okay.
Because this phone, they emit a bit of radiation, but not, and even transformers, you know, they also emit radiation. Yes, all those, and those who work in the X-ray department, they wear lead aprons to protect them from the radiation. So it's not like you would definitely, but you are more exposed to it. Yes, studies have shown that you are exposed to it more than the average person who is not exposed to this radiation.
So in this case, you know, for
possible.
Right?
Yes.
Now, mobile phone is here. I'm my kai. Mostly, they are hand mom if you were touch a chair. Sika, war hanky mo. That was Asha. Be homework what's them, my, you know, was I. Or be who cry on to share or hanky mo, mostly in the paper, no paper notes. One saka, no was I say. Hakokono, boko, no shasi hobby. I had to say that no so cry to mama breast cancer. I shall is it through that no so to mama breast cancer.
With breast cancer.
Before I answer me, what no him panty, yan try no hokaka, and one a yanjin cartona eba. Now, when I can want some timmy patch up, menko baby, Sikana yes, she henu for hono so. And they are general nurses will fear her, worrying my head, you know, advices about breast cancer. And breast cancer no cry no be hot to who cry abazi. In China, yeah, but we continue with this discussion. All right, Akwaba, and then Yakasa about breast cancer. I told you that this month is the breast cancer awareness month. Into the month of October, every single day, every Tuesday, be on Girl Vibes, no, you have more education about breast cancer. And then yeah, church we ye yankasa because you're general nurses will fear. Now before breaking number bisa, Aisha there. Yana mama no ma what nazi will go me. Ebokona scanodia. In fact, tomatoes eat 12 year man 5 cities nana zoom. Not that she no in fact obi crab ma bra na se cra dia kwose bra na se betumu ewu de heat the back scano tumu kwanu fu na buy. Na Aisha no so ya to do my breast cancer ni bi. Na no who come out today. Is it really true that
breast cancer no our miska me ma ada awa som ida am na me so ma fiskan na me da she menu for ho all these things will harbor organisms, microorganisms, infections, and it doesn't even sit well.
Okay.
So aside even breast cancer, it's not hygienic. Keeping money there, some people even go as far as putting their phones by their breast. So all these things are not healthy.
Okay. Now, talking about it not being healthy, you know, we are also live on Facebook at eTVGhana and the all questions be about breast cancer, no, on cherry, maybe dining in Anna, Yebusa Hen, Messia Free. So, Mamma, but Farida Holmes, so Nana so cacao never fast scan because cannot say, no, we am pa. And I met on as well market. And say, and I'm a market, not me who my men for the day. What this scanner share one end of us, Nafari, I get worried.
It's true. Yeah, you have to be because. If it doesn't lead to breast cancer, but infections in the breast, it's not hygienic. You don't know who has touched the money, and even lead poisoning. It's very unhygienic. You shouldn't do that. You should keep your money in a wallet, no, in your breast, and the sweat and the build-up of organisms, and maybe the person won't bath, go to bed, and then. All these things lead to something else. Yes, so it's very unhygienic. It's not advisable to keep your money in your breast.
Okay. Now, talking about the bath, and how do we even bath the breast? Sorry.
There's no particular way of bathing the breast, but you should keep your breast really clean. Like when you are bathing, take care of the folds around the armpits, and then under the breast, you should clean very well with sponge and soap and water, clean running water, and then bath the breast well. But it's not like a particular, but you should always make sure you bath at least 2 times.
Especially when enough to be woman
yes, especially those who are busty.
I am Madonna, you know, yes, space to space, baby.
And even clean the after you've bathed there, you need to wipe there dry because if it's wet
water
and then moisture, so you have to clean.
Do we have types of breast cancer?
Well, yes, we do have types of breast cancers.
Okay.
So, we categorize them into 2.
All right.
Invasive and then non-invasive. So, non-invasive means it's in the early stages. It hasn't spread. Onko nature ebakadebia akoka organ way another. But invasive ache atinemo ache inti affect other organs. Basically, yes.
Now, at what point, and I say, mean your breast cancer or the medical hospital?
Well, immediately you detect a lump, you should always report to the hospital.
Okay.
Or even a discharge too. When you have a discharge, you should. Some research has proven that normal clear discharge like water is normal, but even with that, you should just, to be on the safer side,
you have to go and check.
Yes, check if it's completely normal. It could also be due to hormonal changes. You know, women, we are always having this funny hormones. So, but it's normal. But you should just to be on the safer side, you should check.
And we also hear this that breast cancer to me inheritance. You know, to me oh mama ho papa bi ebusuya, you can inherit it from the family. Is that also true?
Yes, breast cancer can be inherited. You know, as I talked about earlier, your genetic makeup, we are made up of genes. We inherit these genes from our parents, and then they influence our growth and development. So the cells work according to your genetic makeup. So if there's a cancer, maybe a woman has developed a cancer, she could pass some of these mutated genes. When a genes become mutated, like let's say you've had breast cancer, so it's beginning to go out of control. So it's not the normal gene that's how the normal gene is supposed to work. You could pass it on to a child, it could. And when you have this gene, you are more likely than the average person. Let's say maybe if average person has 25, you have like 50 or 75% chance of developing breast cancer. Yes.
Okay. Now, Aisha, let me come to you. Does it mean that mommy will be I should be worried that since no matter what I do, maybe?
Oh no. Okay. No, it's just that your chances of getting it has been upped. So it doesn't necessarily mean that my mom had breast cancer, so I'm definitely going to get it. No, that is not it. No, we shouldn't fear.
But there is a probability, as you said.
Yes.
And also one of the risk factors is having a close relative, someone in your family has breast cancer, you are more likely to also get it. It's one of. So you should go for screening so that even if you get it, you could detect it early so that you
and fight against it. And then there comes the self-examination as well. Now talking about the self-examination, no, Aisha, and kabatu is here na from kakra base more way and na last week ya sha say na ye church mu kakra ba na time no ko etinda ne ya sha da and there's a yabema a church mu ye ya ma na enya daje ye gim there is a one son is ko wechi kakra na
so breast cancer
be for hand stages in kakra Mr. Cameraman but for camera no was that to screen the board no po be easy ama so I think the first stage na yes akona for images no for church here.
So until first no you have to of course take everything you're wearing so that your chest is exposed and then you stand straight in front of a mirror and then so you lift your hands and then place them behind your head so that you can examine your breast. So you look at the breast. We are looking for changes. Any change in the breast is one bigger than one.
Okay.
Is there any dimpling? Has the color changed? Is there any color change in the breast? Has my nipple retracted? Has it gone inside? We are looking at all these, and then so starting if we are examining the right breast, the right hand has to go behind.
The way to go.
So that's So we use the second, third, fourth fingers. And then we are using the pads of the fingers.
Okay.
Yes. So in a circular motion, we start and then you palpate.
Okay.
Or massage.
Massage.
Yes.
Massage. More times this but when we get the massage this we all get to understand.
So we start in a clockwise position. So we are starting from 12 o'clock.
Okay.
And then you palpate and then you come down around the breast. Yes. So we are looking for any unusual lump.
Okay. In the breast.
Yes. Anything strange you find. It's not. So that's what we are looking for. So you as you are massaging, you don't lift the fingers of the. So you do this and then you come in. No. So it stays on as you go around it. So it goes in a until you come back to where you started. You come down to the 12 o'clock. You come inside the 12 o'clock and still go around until you are at the nipple.
Okay.
So after you are done, you squeeze the nipple for any discharge. Yes. So if there's no discharge, there's no lump, nothing.
You're free.
You're
clear.
Fine. And then after that, you repeat for the other side. You can do it in the shower after you've applied soap or sponge. So there's easy. You're able to move around freely. Yes. Or after you've taken your bath, you lie down and then you do the same thing.
Okay.
Every month. But it's supposed to be 3 to 7 days after you've menstruated.
Oh, okay. So we have to wait till our menstruation is done.
No,
it's not just any day.
Well, during ovulations, some
yes,
of us
yes,
get
yes,
pains.
Yes,
so you can't. So you wait. Yes, 3 to 7 days after and then you're clear.
Because sometimes when you're menstruating, the boobs changes.
It changes,
you
and
feel it really
there's
hard
pain
sometimes, and
and
there's pain and all that.
Some people feel pain, but
Let me ask you this question: is it normal to see discharge in the breast after menstruation, right after menstruation, or even during the menstruation? Is it normal?
No, it's not. Menstruation, they start when you are supposed to have breast milk flowing after birth, like when you are supposed
after
to childbirth, or you are breastfeeding. That is when the breast have to express milk.
So when you're menstruating and there's a discharge in your breast, it's not normal?
It's not
Should
normal.
report.
You have to have it, report to the hospital and have it checked. It's normal.
Okay, so a friend discussed this with me, and funny enough, she's watching on Facebook at eTVGhana. And you know, I'm sure the wing and answer if also question me about breast cancer no as it at eTVGhana Facebook as a commenter. Mekana mesamo na ye self-examination we are there who there you and mensa or then also cry to be checking the mamma social media kakra at Aisha na me can commenter oh kakra enti okay yen chai no kakra ye ba na me read WhatsApp okay me kind of kakra ewa. So Mohammed Zibo says keep it up Farida, and Tariq Abdul says as you can see, my beautiful wife is speaking eloquently. Hey, oh, Farida. Okay, so where's your ring?
I'm not married. He's my husband.
And Hajia, Beauty Queen says, yay, Farida, you do. Oh, it looks like they are all giving funds to my guests today. And this is Nanaisha all the way. Should I talk? Okay. And this is Farida, you look gorgeous. And is your sister Ernest? Okay. I think he's kind of, pampering the sister all over there. Here to support my own reader. Okay, so there are more of high messages on the Facebook. Let's go for a breather. When we come back, I get to read the questions on WhatsApp for you tonight. This is Girl Vibes. Stay and stay. From the break. So my phone lines are activated now. Make sure you call me. We are talking about breast cancer tonight. So any question you have about breast cancer, please call us now. In case you have breast cancer and you're, scared towards the surgery, you can also call us so we get to talk about it, because I believe there's no fear and panic about this. I mean, your breast is, causing this cancer and it's eating you up. So call us on 0555 657 278 055 5657 numbers nusu go screen na say enti Mr. Efa na from and they on Girl Vibes in bring you enti Mr. Wa ebe fra na friend in tem Farida will fear her Aisha so wa ha general nurses and also students from Kolebu a hono work school she has will practice and kasa enti fra na all the questions about breast cancer no or how obetum the way you are na obisuri bisa wo WhatsApp they say breast cancer no can it affect your breastfeeding?
No, normally those who have cancer do not breastfeed.
They don't breastfeed?
Yes.
Oh.
They're affected
breasts, but if the other breast is healthy, you can breastfeed.
Okay,
but
so you can use the one that is healthy.
Yes.
But the affected one you don't have
and
to.
some would advise you hold on after treatment before. So you hold on with the breastfeeding till treatment to determine what kind of cancer. You know the cancer, we have two types.
Yes.
The benign and the malignant. If it's benign, they have to take it out. And the malignant is the one that spreads to the other tissues.
Okay.
So as for that one, they have to run tests and
on
scans, yes, and do x-rays before to determine the extent of damage done and the possible treatment.
Okay.
But for the benign, that one, it doesn't spread. So they have to take
Yo, and to open a question, also what's my friend? Yeah, we have one at some number no screen, the 0555657278. For him, Sisiana, Yan Chuchun, come on, how be what way no fumete, no phone of food be what we two on Cochlear, and then nurses will fear free, watch and self examination in Yanano, and to what question I will be an etoba, ye be you are no. And so say, I'm Akia from Kolebu, you're doing well. God bless you guys for the good works. My regards to my nurses. Okay, so I believe this is a colleague from Kolebu, and this one says it's raining, no, and you girls are giving us this education. God bless you. My question is, please, can breast cancer affect childbirth? Hey. This is a deep question. Aisha.
Can breast
Can it
cancer affect
childbirth?
childbirth? Well, so if someone is diagnosed with breast cancer, the treatment is going to depend on the age of the person, because some of the drugs, that's the chemotherapy, the drugs used to treat the breast cancer, some of them decreases your chance of giving birth. So your doctor is going to discuss that with you. Have you given birth before? How old are you? And then he's going to determine the best treatment for you, and also going to ensure that in as best way possible it doesn't affect you. So no, you can still have kids after breast cancer.
Cancer. Okay. And see, is it? Champion, you must some cousin and no show my please. You can still, get to give birth. Now let's go to the surgery side. Now, obi ohon your breast cancer na say, today, breast cancer is in your your surgery. And when now, I could do no point, she will just leave the breast to, cancer no obe allow mu is just because of the panic and the fear. What to do be your surgery in pocket no abonu. And in such instances, no, is the cause of panic and fear really necessary, or they is true? Say what catch your day in your breast cancer?
No, we shouldn't. We shouldn't fear. Breast cancer is not a death sentence. In as much as you would be anxious, you haven't been through it before. Okay. It's not a death sentence, and you would rather lose one breast, even if it's one breast, and be alive, live a normal life, than allowing the breast cancer. You know, breast cancer can spread to your spinal cord and cause paralysis. Wow. When it spreads, metastasis, we call it metastasis, yes. When it spreads to other organs of the body, it can cause cancer in other organs, and also lead to, like, you have a lot of issues going on when it goes to other organs. Okay. So you wouldn't want to be in that state. So in as much as you would be afraid, but you shouldn't panic. It's not a death sentence.
Okay.
Try speaking to those who have gone through it before too.
Okay, so this is from GH Entertainment page, and DJ Adam says, I see you, Messi B. I'm trying to call, but the network is not saying your number is busy. Please take care of our lady's breast for us. Okay, that is why we are talking about this. Talking about the network, I believe they're in Suna 2019. I'm worried, but still try to call. I believe it will come through a fry and sabekana. Now on the surgery, okay, so obey to my pass it through to hello, good evening.
Yeah, hello.
Hi, darling. Good evening. Your name and where are you calling us from?
Yeah, I'm the Kia who just spent the
Oh, Kia. Baby, yeah. The cooler.
Oh, Yamanado. Yeah, Michia, my colleagues know they are doing well, they are looking good. And you yourself, you are looking fine.
Thank you, darling. Thank you.
Yes. What is our question? We say, and then the money and go for sure about breast cancer. The problem is, Obi Ohonma, hospital. Or detect again. We are not talking about men story. We are all Christians. We have Muslims. We have other religion that we believe in. But go to the hospital. Let's detect it first, and then you tell your pastor or your imam or whoever you believe in, so they will pray with you in the spirit. But people will not come to the hospital. They will rather go to other places
what
that
they said,
they think that but then later on, by the time they realize, say, hospital, now you're too late. That is where a baby detector say, no fall. Thank you.
Okay, I made that ate for being a nurse also as this education as I bear that bring young coupon in show. Bimu cran what's it that will bear when surgery. I had my young coupon future for home crying and a kia cran or one margin accord or being a breast cancer, what body penny and naturally a prayer camp. Or boko myself would in so when you free damage or the hospital for not adrenagin sim. Please, I mean, after listening to all this education, please, self-examination, no here. And I believe to them work right after your menstruation, please. Personally, I'm going to practice that. Fact, may check it, but I didn't know it was after menstruation. Now I know. and I'll make sure I keep up on that. Now, sorry, I am now once I ever should able to be in your course. You sooner return into my network or my client in the one fan chain. Now, cheesy pigs are saying the main chamas. And now, before I make a crab, Mrs. and the crab is better one. Me pedami was our last question here. Is the surgery the last option?
Well, we can't say for like surgery.
Okay, I have a caller, so hold on. Hello, good evening, caller.
Hello, good evening.
Good evening, my dear. Baby Abokoa.
Yami Nadumboko.
Yadangami Simpache, you bring more one uncle.
Mpocho, I casa war, eTVGhana.
Mpache,
Boko. Mpocho, me call from Takradi.
Attack rather for you, more one uncle.
Yo, Mpocho was from Abba.
Yo, ma, more one uncle.
Na, Nanya, 72. 72 na Monday mehu insu kakra wo menu fun.
Okay. 72 is the next that way we are paying na edu
my 72 my bibia me we many for my papa da
breastfeed area that but still who the charge
should you bakade oye
enu funcionara
olive oil kakra.
Okay.
What do you say about it?
Okay, my yeah, that's the nurses no hati. Kodosha na yebe you and you. Miss me that's baby. And in her 70s, our breastfeed area, I mean long ago, and still feeling this discharge.
We talked about the signs and symptoms. Yeah. You have spontaneous nipple discharge without any cause. It's one of the signs and symptoms of breast cancer. So should report to the hospital to have it checked. It could be in the early stages, and she could get treatment as early as possible before it spreads.
Yeah. And see, the mommy be see her not yet for course be and they are very up on girl vibes. Yeah, that's super brave to know be a shame. In your 70s, I believe that to them my head necessary. Okay. And some mommy may stroke hospital who hear me pa. I say, but that's so today you bring your time next girl vibe. So be a na as all questions so zapa. Call hospital, yami ya too much na my doctors never can be ano na a follow up. 70s is it one who hear him papa. May do be also said that or share na Ferry and Aisha and the cheesy pigs. I want a debut. I was so here asking my as a girl vibes. No be up, but show you to be answer. What's the year pedetro when you spend day? And to young fat cheesy pigs about Aisha Jacker. Aha, Ferry that was in it. Men for cry, and to Jennifer. Then I see baby. Then the man that you're not more behind this education about breast cancer. Marcus upon a minimum day, you have to wait until after your menstruation before you check. So it's been needful to me.
So first day is day 1. So
Okay.
like 7th day, then you can do it.
Okay, so right after
After
the menstruation.
Yes.
And
then
a bit more for 10 days since after 10
Yes.
days
you can still do it.
check. And now they will 4 and 5.
Yes,
Ning
you
able
can
to
do it.
na a check and patch who hear me pa at this month or year October in Kotese. Every education beyond breast cancer no. Yes, a bit more girl vibes. Now, that cheesy pigs are phone so I say, and they want branches and Ghana hanging na baby a biwo echo ring road that water more one or your favorite sis here every Saturday be but by we are break it and I'm term more my Jimmy cheesy pigs echo water or caswan so hobby baby dance so man la pass cheesy pigs are echo me permit lovers and no your favorite na a person no fee and pest stress not fresh 050 2533 397 050 2533-397. Efra will be deliver. Now was a monty matter was sister. Self-examination and they actually making sure they obey will feel all the time. Maybe your menses are in fact, fuck our menstrual cycle no. Now can your menses na every month be a na check mens more by your poems and then no for no so. No home but now we ye now one ban so when you prom. Now Aisha and a Farida so Madam Wasibi Yamis Shamu for this education. My name is Mercy B the Akunfi Princess. Please follow me on Instagram at Akunfi Princess. Now vote in my hand for Ghana Tertiary Awards. Now you win TV show of the year. Now yami adoma next week now comes awards see. Is able to hana your comment. Madam producer and the entire crew as say. Yami adoma the Sunday ever Sunday. Good night.